So as a community table, we share information, we facilitate discussion, and hopefully catalyze collaboration and partnerships where they can work together in piloting as well as kind of promoting different kind of interventions that would bridge that digital divide. So for today's meeting, we have brought Pauline Martinez here from UC Davis. She's been leading the evaluation of a pilot in California called Lighthouse for older adults, which has been looking at advancing digital inclusion for older adults in affordable housing settings. So Pauline's going to share some of the evaluation findings with us, as well as some of the learnings and best practices, and talk a little about what happens next in terms of some of the resources and opportunities for other organizations to be able to replicate what Lighthouse has been able to demonstrate. And just as some background, I love numbers. So Pauline, I don't know if you know, about 23% of San Francisco's resident population are over the age of 60. So we have a very old demographic structure for the city, but also we have 13,000 units, and that's 60% of the city's affordable housing is currently occupied by older adults or individuals with disabilities. So that's quite a high number, among our target population who live in affordable housing. I'll hand over to you, Pauline. And
as Andrew and Carla shared, I'm actually a doctoral student at UC Davis, and I've been working on the Lighthouse project for older adults since August 2020. And I'm actually focusing my dissertation on this topic. So I've been reading quite a bit in the literature, and really am always seeking to learn more about how we can address the digital divide among older adults, especially in affordable senior housing. So today I'll give a brief overview of the Lighthouse project, and I'll talk about our implementation approach. I'll discuss some of the challenges that we faced rolling out technology in affordable housing, and some of the outcomes and lessons learned, as well as highlight some resources. So just to begin, I think all of you are completely aware of what an issue the digital divide was during COVID and continues to be in affordable senior housing. Especially during the pandemic, people were extremely isolated, unable to access resources, and the silver lining of the COVID pandemic was that this kind of brought to light this need to address the digital divide in affordable housing. And one survey that was put out by Leading Age asked service coordinators what were the top reasons that they thought that internet access was important for their residents. And about 85% said it was critical for their resident well-being. 60% were believing that technology was important for telehealth access. And then just overall digital equity was important. And speaking of Leading Age, we're actually with the Lighthouse project just this week, I found out that we're going to be working really closely with Leading Age California, who will be ensuring the sustainability and replicability of the Lighthouse model. And so really excited for this new partnership so that we can work with Leading Age members. So the Lighthouse project overall, our objectives were to roll out a technology-enabled health and well-being pilot for residents living in affordable housing during the pandemic and beyond. And we really wanted to produce a rapidly deployable and scalable pilot program that addresses internet accessibility and digital literacy training to improve well-being, access to healthcare and services, and communication. And the primary investigator of our project was Citrus, the Center for Information Technology Research in the Interest of Society. And Citrus is actually a partnership between several of the University of California systems, including UC Berkeley, UC Davis, Santa Cruz, and Merced. We work really closely with David Lindemann, who is on the board for the San Francisco Tech Council. We also partnered together with Eskaton, who's a major housing provider, and they own 34 communities. And specifically with them, we were really focused in their affordable housing communities in Northern California. And we also worked with Front Porch to pilot the Lighthouse project in some of their affordable housing programs in Southern California. And Front Porch has their Center for Innovation and Wellbeing. So those were the staff that we specifically were working closely with on this project. And as I mentioned, I'm with UC Davis, so I served as an evaluator on the project, creating the surveys and analyzing the data, and participating also in all the team meetings as we designed the intervention and made changes along the way. So overall, as I mentioned, our goals were to improve health and well-being, to provide access to Wi-Fi and information, connecting residents with things like transportation and groceries and community information and entertainment, and also to increase engagement through the technology training and support. So as of today, well, overall, we are seeking to engage 8 pilot communities. And as of today, we've completed implementation in 5 communities. We have 2 communities in progress and 1 more launching in July. So we've been able to grant Wi-Fi access to 819 residents, provide devices to 911 residents in 14 languages, and provide 911 residents with technology training. And we also produced 14 user guides that were multilingual in the language of the residents. And we really sought to use an implementation approach that embraced a design with and not design for approach. So before we even started any of our intervention at all, we surveyed residents in what we called the empathy phase to understand what were their health needs, what resources were they seeking to connect with out in the community, and what technology were they currently using, what was their current comfort with technology, how many devices did they have or not have. And also we held resident focus groups with the residents and staff to further understand baseline before we went in. What motivated them to want to learn technology and what needs did they have? So here's just a snapshot of some of our empathy survey findings. This came from November, December 2020, so still pretty early on in COVID. We found that 50% of the respondents said that their physical and emotional health was fair or poor. And 60% reported experiencing visual, hearing, cognitive, or mobility changes or difficulties. And they really said that their social isolation increased during COVID and worsened their physical and emotional conditions. So people were saying things like, I don't want to get off the couch, I've lost my appetite, and really extreme social isolation. And when we asked them about their technology use, it was really just phone calls primarily, and primarily they were connecting with family and friends. And they said that it was really difficult for them to adopt technology, especially due to language barriers and just the need for ongoing support. And we asked them about telehealth because early on we were thinking maybe that would be an important part of our intervention to connect healthcare providers with the residents. But what we found specifically, we were working with 2 communities down in Koreatown in Los Angeles, and they were seeing a lot of private family providers. And so it became really difficult for us as outsiders to have the providers have the right technology to have telehealth appointments with their patients. And so what we learned was that the patients really wanted telehealth to be initiated from their providers, and that wasn't something that we could necessarily intervene in at first. And so we really sought to focus on our intervention on providing Wi-Fi access and basic digital skills. So overall, our intervention kind of had 3 components. The first was installing the internet and ensuring that the internet was going to be maintained and accessible from every apartment. The second was the digital literacy training and technology support, and I'll go into further detail about each of these. So the second was the training and tech support through curricula, design and deployment, outreach strategies, and really engaging residents in supporting residents to ensure that it was sustainable and not creating too much of a staff burden. And then the third piece was really getting expertise on which apps and training content would be most meaningful to the residents and making sure that it was in language, which was a huge challenge. Some of the communities we worked with had up to 8 to 10 different languages just in one community by itself. So just first, the Wi-Fi was the first big challenge, and that took us. We're still working on installing Wi-Fi in some of our communities due to the community layout, having long wings or old buildings that just were not built with Wi-Fi installation in mind, or communities with multiple buildings that where the cost for installing Wi-Fi was significant. And so we also during COVID, as you all are aware, there were a lot of delays with getting staff out to the communities to do the assessment and install the Wi-Fi, as well as supply chain shortages. And so across the first 6 communities, we found that the cost of the Wi-Fi was about $520 to $2,400 per unit. And that included the cost of installation, maintenance, and ongoing monthly costs, which we did not want to put on the residents, but instead make this part of the model. And so for this project, and maybe I should have mentioned earlier, was funded by a private funder. And the idea was to look at how can we keep the costs as low as possible while still providing Wi-Fi that had a good broadband speed, and would facilitate technology learning and use. And then later we wanted to look at how can we find long-term sustainable funding sources and policy solutions so that this can be rolled out through the rest of California and also throughout the rest of the nation. So these are 2 resources that I found particularly helpful around Wi-Fi installation. The first was one that was not produced by us, but I thought was really insightful in terms of what different types of technology can be used to provide Wi-Fi to residents' apartments. And the second one here is one that our team put out. And I'll be making my slides available to all of you after the presentation too, if you want to follow up on all of this. And I just want to clarify with the Wi-Fi, because I'm on the evaluation team, I was not directly involved with the Wi-Fi decisions. So if you have more technical questions about the Wi-Fi, I'm happy to refer you to some of my colleagues on the Lighthouse project. So the next big piece of the project was deciding which device we wanted to give to residents. And we really wanted this to come from the needs of the residents, not necessarily what devices were cheapest or were offered to us, but we wanted to ask the residents which devices would be most user-friendly for them. And so our staff actually went out and brought a variety of different devices and had residents test it out, and they gathered feedback. And what they heard was that residents they really liked tablets. They liked the larger screen size that accommodated for vision changes. And they really needed a good quality speaker or an extra headset due to changes with hearing. They also were really interested in video chat and voice first capabilities on the device. They needed a stylus to help with fine motor skills to ensure the haptics of the screen would work optimally. And really important was the multilingual accommodations. As I mentioned, we had so many different languages represented among our residents and limited English proficiency. So throughout all of the 8 communities that we've rolled out, we used a variety of devices. We actually started first with the Google Hub Max device, which is here on the right. And Velara was a software company that provided the interface on that device. And it really simplified it to be focused on video calling, on YouTube and music and reading the news. And that actually, because our Wi-Fi was taking so long to install, that was our first pilot with just 20 residents across 2 communities. And that actually came directly from one of our colleagues on the project who had those devices donated to her. But it's interesting, actually, I just this afternoon had an interview with one of our service coordinators in one of our communities, and she said the residents are still using these devices that we rolled out back in, I think it was November, December 2020, and they're finding them really helpful to connect with the service coordinators and the residents, and really enjoyed using these devices. Next, we went on to the Lenovo Yoga tablet. And unfortunately, due to changes with Lenovo, they dropped this particular device. And so that's what we learned early on, because we had spent a lot of time deciding which device we wanted to use. And we were all really excited about this Lenovo Yoga tablet because it had the multilingual capabilities and a lot of the features we wanted. It had a lot more features than the Google Hub Max with the Velara interface, which, as I mentioned, was really limited. And unfortunately, what we learned was with any of these intervention pilots, we can't get too married to one device. We need to really focus on the model overall and have flexibility as technology changes that we can adapt. And next, we rolled out the Samsung Tab A7. And then just recently, we actually partnered with Amazon on rolling out the Alexa Show to a device. And in this final community, what we did is, depending on the residents' needs, some had hearing challenges, so the Alexa Show device, or sorry, the tablet was better for them, and others, the Alexa Show was better. So we ended up rolling out a variety of devices in one community according to the needs of the resident. So we also tried out using mobile device management in some of the communities, but not all of the communities. So what this was paying a second party that would help setting up all of the devices for the residents by creating emails for the residents and downloading all the apps, organizing the interface. And what we really hoped, the reason we wanted to partner with the MDM was so that we could gather data on how much the tablets were being used, the frequency of the use, the variety of applications that were being used. Unfortunately, due to privacy issues, we were not able to gather that data. And we also found that overall, the expectations that we had from the MDM were not met. On the other hand, the consumer-based model gives you a lot less control as a provider. You're basically giving the devices out to the residents, and if they move or they get the device to a family member or they're not using the device at all, you as the provider have no control or no insight into that. So it's also a little bit more labor intensive for the staff in terms of downloading updates onto the devices, whereas the MDM will manage that. So it's just kind of interesting to compare these two. And our team is still kind of, the jury's still out on which one we prefer. And then the implementation model in terms of digital literacy training, what we did is we selected resident ambassadors who would be available to provide tech support for their neighbors. And we identified resident ambassadors in each of the languages that were represented at the community. So for example, today I'll share some of the findings from Jefferson Manor, where we had primarily Cantonese, Mandarin, Vietnamese speakers, as well as some Farsi speakers and Spanish speakers. And so we trained resident ambassadors who were fluent in those languages and provided the devices in advance for them so that they could later provide on-site office hours in the community for their neighbors. So it's almost like a genius bar where the neighbors could come to them every, on a specific day and time with their technology issues. And when we deployed the devices to all the residents, we either went door to door or we made an appointment and the residents came down to the community room to receive their device. And that's when our staff would set up, their email or set up the language, especially for the keyboard and the language of the device, and also provide a device basics overview. So how do you charge the device? How do you restart the device? Just some of the really basic skills. So these deployment appointments took about 45 minutes. And sometimes they were one-on-one with the residents, or sometimes we had a group of residents all show up with their friends at once, and then our staff member would deploy the devices to all of them at the same time. And we also provided user guides that were in language. And I just want to clarify that the user guides did not have a lot of text. They were primarily pictures and screenshots with arrows to give to give instructions on how to use YouTube, use Zoom, and just device basics overall. And then from there, we held a series of 2 to 5 training classes, and those were held once a week. And what we did was we had one of our staff from Eskaton or Front Porch would go in and lead the class, which was 45 minutes to an hour. And we engaged one of the resident ambassador, to provide the translation. And the topics for the training classes are listed on the slide here, included device basics, YouTube, Google Translate, how to access the App Store and download apps, take photos and view it in your album, use Zoom, make video calls, Gmail. And then we also, if there was time and depending on the community, would cover some specific apps that the residents were interested in. So for example, in one of the communities in Koreatown in Los Angeles, they were really interested in some of the apps listed here: On Demand Korea, Korea Times, Radio Korea, and Tubi. And then after the training classes and throughout the training classes, these office hours were led on an ongoing basis by the resident ambassadors. And then another big component of our model was creating these community groups or pods that socialize the learning and tech support. So we try to, if we deployed the devices in groups, we try to maintain that same group in the training classes. And we encourage the residents to reach out to one another to get their questions answered. Okay, cool. And we really recognized that learning was social and it needed to be part of the community and the culture to make it sustainable. It couldn't just be us coming in as outsiders and dropping off devices and then leaving, because we did not feel that would be sustainable. So I just want to pause here. I see a lot of different chats in the text.
Yeah.
Carla and Andrew, if there's something.
Sure. I let me summarize one from Hannah Griggs, who works at Curry Senior Center, which is in the Tenderloin. And they have a program called Senior Vitality at Curry, where they use iPad devices. And Hannah was saying that both from a usability perspective, the clients or residents there enjoy using the iPad. And then from a curriculum perspective, when there's updates to iOS, it's easy to update the curriculum. And so she was just curious, had you considered use of iPads as one of the device options, understanding that it is maybe more expensive than other devices, but just curious to know what consideration was given to the iPad.
Yeah, a big part of our intervention early on was using Google Translate and Google Voice, which we felt like was able to accommodate more languages. So I believe some of the decision was the cost of the iPads. As you mentioned, that was a big piece, but another piece was really we wanted a device that had capability for Google Voice. And something that we learned that was interesting is while Google Voice worked really well for many of our languages, unfortunately, it did not work as well with our Cantonese speaking residents, especially because there were different dialects of Cantonese spoken among the residents. And so some that spoke Toisanese had a lot of challenges with using that Google Voice First feature, which was an interesting lesson that we learned. Good. So next I'll talk a little bit about the program evaluation. So we collected surveys at the day of deployment, at 30 days and 90 days, as well as smaller, just half-page surveys after each workshop to get feedback, because we wanted to, as I mentioned, create the scalable model for other communities. So we really did an in-depth evaluation of this project to capture lessons learned. And the surveys were translated to multiple languages and they were in large font. And we really had to cut down, I'm coming from an academic institution, so we love our surveys and our validated questions, but we tried to cut things down and we pilot tested all of the questions to ensure that they were understood in the various languages. And we also evaluated the project through qualitative data and through interviews with the staff, resident ambassadors, and volunteers. And so I'll present the findings of our first full deployment today, since I thought it would be a good starting point for discussion. And at Jefferson, so our first community was Jefferson Manor in Sacramento. And they have about 200 residents. And as I mentioned earlier, they represent about 8 different languages. And we found that when we wanted to shoot for 100% of residents participating, but in the end, about 72% opted into the Lighthouse project And they did have to sign a consent form where we asked them to attend at least one training class. So I'll talk a minute about some reasons why some chose not to participate. Of our participants, 75% were female, 62% were Asian, and 68% lived alone. The average age was 78, and about half had less than a high school degree, and 65% had limited English proficiency. And the primary languages are listed here: Cantonese, Vietnamese, Mandarin, and a few Spanish. So some of the reasons people chose not to participate, and what was interesting was a lot of the English speakers opted out. And some of the reasons were they already owned another device at home. They were not interested in the yoga tablets we were offering. A few people reported having visual challenges, or a family member said that the resident had cognitive challenges and they thought it would be too stressful and confusing for their family member to participate. And some were unwilling to complete the surveys, or they didn't want to attend the training classes. And others said they would prefer to use their tablets learn to use their tablets with their family or a nearby senior center. Out of all of the participants at Jefferson Manor, 89% attended at least one class, and we offered 3 classes, 1 per week for 3 weeks. And those were, as I mentioned, translated into the participants' language. And we had really high participation here at Jefferson Manor. And we also asked the resident ambassadors to keep track of what kinds of issues came up in their office hours. And these were a few that came up repeatedly: was troubleshooting touchscreen and volume issues, changing the language and accessibility features on the device, reviewing training concepts, so things like YouTube and Zoom and just device basics. Some residents wanted apps downloaded that we didn't cover in the group classes. So things like WeChat was really popular, Chinese TV streaming, or apps to connect with their healthcare provider. And some participants really just needed extensive basic skills support. So things like their screen would be black and they didn't know what happened. And it turns out the device needed to be charged. Or when they tried to turn the device on, they pressed the button, but it didn't turn on immediately. So they had to hold their finger down for a couple seconds to get the tablet to boot up. Or sometimes they would inadvertently hit airplane mode or accidentally dim the screen and they didn't realize that that had happened. So just really basic troubleshooting issues. And some of our resident ambassadors really flourished and did a great job, whereas other resident ambassadors, we found that they had volunteered because they like to be social and they wanted to be helpful, but they didn't actually have the tech skills to be able to help with even just some basic things. So we really learned from that we needed to provide more training and support for the resident ambassadors, and also some just basic things that we added to our curriculum later. So how do you check the battery level on your tablet? If you get disconnected from the Wi-Fi, how do you reconnect? And also assuring people that if the Wi-Fi is acting really slow, it's not their fault. You know, it might be a busy time of day, or there could be an issue with the Wi-Fi or the device that's not connecting. And that was something that we heard from the residents is they felt like fearful they were going to break the device. And if something was going wrong, they felt like it was their fault. So some of our other findings, we asked residents how frequently they were using the device and what they used the device for. And we found that 82% reported using the device at least twice a week, and many using it daily. Their top activities were entertainment. So that was things like watching the news or watching sports. They loved YouTube. That was really the top favorite feature. Many reported checking the weather, and about 20% of the participants used Google Translate, played games, used the camera and took photos, calendars, and made video calls with the device. And 95% agreed that technology helps them connect with family and friends, and 96% agreed that technology helped them to learn new information and skills. So one thing, just the Google Translate, I wanted to pause for a second here because we found that was a really great tool for residents, particularly in Jefferson Manor, where there was such a variety of languages. And so we covered Google Translate in the training, and one woman went home and she actually was able to use it with her neighbor who spoke a different language, and they had lived side by side next door to each other for many years and had been unable to communicate previously. And so they were able to use the tablets to connect for the first time. And also many of the residents found Google Translate helpful. So if you're not as familiar with it, there's kind of two ways you can use it. One is for the verbal translation, but another way you can use it is through the camera on your device, and you hover the camera over a letter and it will automatically translate the words into whatever language you'd like on your screen. And so a lot of the residents who had limited English proficiency were able to use the Google Translate to translate different notices that they received in the mail that they previously were unable to read. So another finding, and I think you'll all resonate with this, is we also saw that confusion and fear of making mistakes slightly increased from 30 to 90 days. And 53% of residents said it was difficult or very difficult to learn how to use the tablet. And what we found was when we first gave the devices, there was a lot of enthusiasm and positive, comments. Thank you for giving us this tablet. I can't wait to learn it. And then as time went on, people got confused and they ran into issues, and they just thought they had all these early expectations that the tablets would help them connect with family and resources, but then they realized that the tablets were a lot more complicated than they anticipated. And so there was a little bit of a dip around after the training classes where people felt discouraged. And really this shows that there's a need for ongoing engagement, whether that be through ongoing classes or connecting residents in an interest group where they can connect and explore the tablets together, and continuing to provide the tech support. So here's just a few comments that came in on the surveys. One person said, I went on Zoom, but no sound, but I did get in for the meeting. After 20 minutes, I shut it off. This is good. I'll try again. The tablet is a good thing. Another said, I think I need more time to be familiar with the technology. A third person said, I have developed memory loss. I want to learn, but no longer able to remember and use. And a fourth person said, this technology is too hard to do this. I am not understanding something, but I'm trying and get help from my church and family. On the flip side, people had really positive responses to the intervention itself. 90% were satisfied with the technology support provided. 93% reported that the in-person classes were helpful. 84% said that the user manuals were helpful. And 70% said they asked a family member or friend for help or went to one of the resident ambassador-led office hours. And about 42 to 53% received help from a neighbor for their tablet. So this is funny because today I interviewed our service coordinator to ask about this data, and she said that almost all the residents told her they did not use the user manuals. And so when she saw the statistic of 84% reported the user manuals as helpful, she laughed about it and said, I think they're just trying to have a positive response and kind of give you a thumbs up for everything that we've done. But in fact, she, from her qualitative, from her boots on the ground perspective, she felt like the user manuals were actually less helpful than in-person support. The residents really had that preference for face-to-face. So we also wanted to evaluate health outcomes in the project. There was really big a desire from our project leads to make an impact on resident health through this project. And so we used some validated survey tools to measure depression and loneliness. And we also asked participants about their self-rated health over time to see if there was a change. And what we found was there were not significant changes in these measures. And so just kind of emphasizes the fact, well, one, it was COVID, and there were changing protocols with social isolation. And also, I personally feel like it's unrealistic to expect to create a change in one's health simply by providing Wi-Fi in the tablets, and that some of these outcomes might take more time and specific interventions to impact these. But sorry, just one more thing I was going to say about that slide. But we heard subjectively that there was a positive culture change in some of the communities, and that people really enjoyed connecting with one another through attending the classes together. And there were perhaps really positive outcomes that were just not measured by these validated survey questions. So just as an evaluator on the project, there were a lot of challenges with the survey data. It was challenging to identify validated measures in multiple languages, and we had to keep translating every time we made an update to the survey. And in general, the residents have low literacy levels, and what we heard was some of them just kind of were checking boxes that they didn't understand the tech jargon. So words like Wi-Fi or tablet, we really had to clarify what that means. And there were some cultural barriers to discussing mental health. So we really relied on the social services staff to be champions for the surveys and really for the whole project overall. And what we found in some of our communities was if there was a staff who was less of a champion, we were a lot less effective at getting the surveys back and engaging the residents in the training classes. And we really wanted the residents to understand why we were asking them all these survey questions, that we were trying to learn from this project so we can benefit other communities. But we found that the residents experienced survey fatigue when we asked for multiple surveys throughout the project. But on the flip side, our funders would like to see the quantitative data. They want to see the impact that we're making through our projects. And so this was really our challenge as the evaluation team, was how do we measure the impact of this entire project with all this money being poured into the Wi-Fi and the devices and the training. We wanted to be able to measure the outcomes and provide quantitative data for funders. But at the same time, there's so many intersectional factors, as you all, I'm sure, are aware, that are impacting tablet technology acceptance and use and learning. So this is actually a shot from my dissertation project. I mentioned I'm writing my dissertation on this topic. And really in the literature and through our personal experience, we see that all these individual factors influence technology adoption. Age, anxiety, depression, personality factors, English proficiency, ethnicity and race, whether one has a support network that encourages their technology adoption and provides technical support, cognitive abilities and cognitive decline, education level, and then physical health factors as well as income all impact technology adoption. But it's not just on the personal level, it's the interpersonal level, what kind of tech support they're getting. At the community level, is there availability of training and tech support through the library or the senior center? Is there broadband available in the community, and what's the quality and the cost? Are they in a rural or urban environment? And at the societal level, things like the pandemic and policies and the innovation and change in technology impacts technology adoption as well as device usability and culture. So just so many multiple different factors that are influencing our outcomes that we're seeking for, that I think these all probably resonate with you since you're all providers too. So I want to pause now. I've been talking a lot, and Carla's going to put out another poll to hear from you. What have you found to be some of the greatest barriers to promoting technology adoption among your residents?
Well, Pauline, just want to say thank you. So much great information in this presentation and in the project overall. And what did you identify, Pauline, as maybe the biggest challenge? Because I mean, looking at Wi-Fi, just even on a capital cost perspective, was quite prohibitive to many organizations, you know, if they have to make decisions. And then there's all the cultural aspects of training and engagement. And I'm just curious, like, what for you are rising as some of those key challenges across all of these challenges, you know?
Yeah, I mean, the Wi-Fi, of course, is prohibitive in the cost. And what we saw is some of the communities at baseline, they offered Wi-Fi in the community room, but not in the individual apartments. And during COVID, the community room was closed. Mm-hmm. But also a lot of these individual factors, I think things like the language barriers was really huge in our project. Especially what we found is in some of the communities, if the service coordinator spoke the same language as the majority of residents, they would be the go-to person. But in some of the communities, the service coordinator did not speak that primary language. So there was this language barrier between the residents and the staff. So yeah, just kind of a recap of the challenges that we faced. As I mentioned, the languages was a ongoing challenge. Encouraging resident participation and understanding the community specific needs. So we really found that we had to tailor the intervention for each of the 6 communities that we rolled out. It's not a one size fits all. And that's making it hard to think about how do we replicate and scale our model too, because we had to change according to what people were interested in, motivated in, what was the culture of the community when we first came in. And just a quick story on that is one community we rolled out in is a rural, primarily white community in Northern California. And they had a lot of resistance to going to classes or engaging in the technology. And there was a smokers clique that hung out in the shed outside. And we were like, if we only break into the smokers clique, then we can get them all in. And we ended up having to go door to door. And the residents would peek their door outside, their head outside the door, and they didn't want us to come in because they were smoking in their apartment. They're not supposed to be. So it was just kind of interesting. Like that was a totally different dynamic than Jefferson Manor, where we had primarily Chinese residents and all these different languages. So all that to say, we had to tailor the intervention community by community. And we also found staffing challenges was huge. When we had one of the service coordinators go out on medical leave for a couple months, it derailed the entire project. And I think we all can relate to that need to have that champion on the project. And we saw waning enthusiasm among participants over time. They were excited to get a free tablet, but how do we keep them engaged and keep them excited about the project? And then also the challenge of finding a device that met all accessibility requirements. We kind of talked about that. So here's some of the lessons learned was adopt a design with, not design for approach. You need to tailor the project. Everything needed to be in language, including the flyers, the curricula, the user manuals, the office hours. And we also really needed to invest in those resident ambassadors if we wanted to reduce the staff burden, and need to continue to plan for ongoing engagement. So for you all to get started with the model, we suggest starting off by understanding the needs of your residents and staff, not just going in and with the devices, but first trying to understand what motivates them, what are their needs. Understand the building and the technology readiness, what's going to be the cost of the Wi-Fi, what barriers exist, and building awareness with all key stakeholders, planning for the infrastructure, devices, and training, and also the ongoing costs, especially with Wi-Fi, and the devices too require maintenance, replacement, and be prepared to adapt. So here is some resources that I mentioned. I'll be emailing this out to you all via Andrew and Carla. So one was a Leading Age, produces several really helpful case studies and guides for providers. There's also some of these I already kind of mentioned, but the Affordable Connectivity Program, I'm sure you're all aware of that, is a really great resource. And OATS, Older Adult Technology Services, and Cyber Seniors, they both, those two organizations at the bottom provide digital literacy training. And they're typically over Zoom, which we found was a little bit of a challenge because we had to get our residents onto Zoom in the first place. And another challenge was the languages, but I am finding that OATS is starting to expand to other languages too now, which is exciting. I'm not sure if you all know Ryan Kawamoto down in Palo Alto, but he's doing classes in Vietnamese and Chinese. And so I think that's a really important piece that was missing for a long time, was this offering classes in other languages. So that's it. Oh, so the resource that's not on here that Andrew alluded to is the playbook. So our Lighthouse team is working on producing a playbook to provide to other housing communities to replicate the Lighthouse model. And it'll really summarize some of what I shared today, but even more, because we are hoping to create a timeline for communities. How long does it take? What needs to be done in what month? And really we're continuing to develop tools, and is really our goal. Right now, our project just got extended through December, which was new news. So we're going to continue to produce products and want to share them with all of you to be able to take what we've worked so hard to develop and run with it, so we can avoid a lot of work for you all.